Getting older doesn't mean giving up your health, but for millions of seniors, the battle becomes harder with every passing year. From memory loss to silent killers, the top 5 illnesses affecting the elderly today are changing lives, often without warning. If you or someone you love is over 60, this is the video you need to watch. The earlier you understand these conditions, the better chance you have to stay ahead of them. Aging is a natural part of life, but as our bodies change, so do the risks we face. For older adults, staying healthy often means navigating new and unexpected challenges. Some conditions arrive slowly, almost silently. Others come quickly and change everything in a matter of weeks. What makes it even more difficult is that symptoms in older adults can be vague or easily mistaken for just getting older. Fatigue, forgetfulness, even shortness of breath. These signs can sometimes be the early whispers of something far more serious. That's why awareness is everything. The sooner you know what to look for, the sooner you can take action or help someone you love do the same. In this episode of Elderly Truths, we're counting down the 5 most common and impactful illnesses affecting seniors today. We'll explain what they are, how to spot them early, and most importantly, what you can do to manage or prevent them. Because knowledge isn't just power, it's protection. At number 5 on our list is a condition that affects nearly every movement you make: osteoarthritis. For many older adults, it begins subtly. A little stiffness when getting out of bed, a dull ache in the knees after a walk, a reduced range of motion that creeps in so gradually it's easy to overlook, until it becomes part of daily life. Osteoarthritis is the most common form of arthritis in older adults. It occurs when the protective cartilage between your joints breaks down over time, causing bones to rub together. This friction leads to pain, swelling, and stiffness, especially in weight-bearing joints like the knees, hips, and lower back. Over time, it doesn't just cause discomfort, it begins to limit independence. Simple tasks, getting dressed, going for a walk, bending down to tie your shoes, become frustrating, sometimes even impossible. And that loss of mobility can lead to more than just physical decline. It can trigger emotional struggles like depression, isolation, and a growing fear of falling or injury. While age is a major factor, osteoarthritis can also be accelerated by old injuries, obesity, repetitive strain, or even genetics. And because it progresses slowly, many people wait too long to take it seriously. But there are ways to manage it, and even slow it down. One of the most effective strategies is low-impact exercise. Swimming, cycling, tai chi, and walking can strengthen muscles around the joints, improve flexibility, and reduce pain without causing further damage. Even short, gentle stretches each morning can make a noticeable difference. Physical therapy can also help retrain the body to move more efficiently, while assistive devices like braces or walkers can reduce strain and prevent falls. Diet plays a role too. An anti-inflammatory eating plan rich in omega-3s, leafy greens, whole grains, and healthy fats can help ease symptoms and support overall joint health. Limiting sugar and processed foods may reduce systemic inflammation, which often worsens joint pain. And while medication may be necessary in some cases, lifestyle adjustments often bring the greatest long-term relief without the side effects. The most important step is not to ignore the early signs. That morning stiffness, that occasional knee pain, they're not just the price of getting older. They're your body's way of asking for support. Osteoarthritis doesn't have to define your days. With the right tools and knowledge, you can stay mobile, independent, and engaged with the world around you. Because movement at any age is a gift, and protecting it is one of the best things you can do for your health. Coming in at number 4 is one of the most feared and misunderstood illnesses affecting the elderly today: Alzheimer's disease and other forms of dementia. It often starts with something small, a forgotten appointment, a misplaced word, a moment of disorientation. But over time, those small lapses become patterns. A name you've known for years won't come to mind. A familiar neighborhood suddenly feels unfamiliar. or a once calm and gentle loved one begins to act in ways that seem completely out of character. Alzheimer's and related dementias are not simply part of normal aging. While occasional forgetfulness can be harmless, progressive memory loss, especially when paired with confusion, trouble with language, and noticeable personality changes, is something that deserves immediate attention. These conditions do more than affect memory. They slowly change how a person thinks, communicates, and interacts with the world. And for the individual, it can be frightening, but the emotional toll extends beyond the person living with dementia. Spouses, children, and caregivers often carry an invisible weight, watching someone they love become someone they don't fully recognize, while juggling the demands of care, safety, and round-the-clock attention. There is no cure for Alzheimer's yet, but early intervention matters. New treatments, including medications that may slow progression when caught in the early stages, are now available. The earlier the diagnosis, the more options there are to plan ahead, manage symptoms, and maintain quality of life for longer. Support doesn't stop at treatment. Organizations like the Alzheimer's Association offer helplines, support groups, and educational resources that are lifelines for caregivers and families navigating this heartbreaking journey. Simple tools like memory calendars, visual cues, and home safety adjustments can make a powerful difference in preserving independence and dignity. It's also important to remember that every person's journey with dementia is different. Some progress slowly, with long stretches of stability. Others face rapid decline. What they all need, regardless of stage, is patience, understanding, and a community that sees their worth even when their memory fades. If you notice early signs in yourself or someone you love, speak with a doctor. Don't delay out of fear. Knowledge opens doors. It brings clarity, direction, and support. And it allows families to make decisions from a place of love, not crisis. Alzheimer's and dementia may change how someone moves through the world, but they do not erase who they are. With compassion, information, and early care, it's possible to meet this illness with grace and resilience. Because memory may fade, but dignity, connection, and love do not have to. Number 3 on our list is something that affects more lives than any other illness among older adults: heart disease. It remains the leading cause of death for seniors, but what makes it especially dangerous is how quietly it can begin. For many, the first sign isn't a dramatic heart attack. It's subtle, a little more fatigue than usual, shortness of breath during a walk that used to feel easy, mild chest discomfort that comes and goes. Heart disease covers a range of conditions: coronary artery disease, heart failure, arrhythmias, but they all have one thing in common. They place more stress on the heart than it can safely manage. And as we age, that stress accumulates. Years of high blood pressure, elevated cholesterol, poor eating habits, or lack of physical activity begin to take a toll. Smoking, diabetes, excessive alcohol use, and unmanaged stress only increase the risk. And yet, many people don't realize they're in danger until symptoms are hard to ignore. One of the most misunderstood signals is fatigue, not just feeling tired, but a deep exhaustion that lingers. Add in occasional chest tightness, lightheadedness, or swelling in the legs, and the heart may already be sending out warning signs. That's why early detection is critical. Regular checkups, blood pressure screenings, cholesterol panels, and even simple lifestyle questions with your doctor can uncover risks long before a serious event occurs. And prevention doesn't have to be extreme. In fact, small daily choices have the greatest long-term impact. A heart-healthy diet, low in saturated fat and sodium, rich in fruits, vegetables, whole grains, and lean proteins, can help reduce plaque buildup and maintain healthy blood pressure. Regular movement, even just a daily 20-minute walk, improves circulation and strengthens the heart muscle. Staying socially connected and reducing chronic stress also play important roles in maintaining heart health. For those already living with a heart condition, management is everything. That might include medications, a cardiac rehab program, or learning to monitor symptoms day by day. But it's never too late to make changes that help. The body responds when you support it. Even in your 60, 70, S or beyond. Heart disease might be common, but it doesn't have to be inevitable. With awareness, routine screenings, and lifestyle shifts, it's possible to protect your heart and your independence. Because a strong heart does more than keep you alive. It keeps you moving, connecting, laughing, exploring, and living the life you've worked so hard to build. And you deserve to enjoy every heartbeat of it. Number 2 on the list is a condition that's becoming more common in older adults, but often goes undetected until real damage has already begun. We're talking about type 2 diabetes. It's a chronic illness that affects how your body processes blood sugar. And while many people associate diabetes with weight gain or poor eating habits, the truth is more complicated, especially as we age. For seniors, the early signs of diabetes can be subtle or mistaken for something else entirely. Feeling tired all the time? That might be chalked up to aging. Going to the bathroom more often? Could just be hydration. Blurry vision or cuts that take longer to heal? Easy to overlook unless you're paying close attention. But these are the exact signals your body uses to say, something's not right. Diabetes develops gradually. Over time, the body becomes resistant to insulin, the hormone that helps sugar move from the bloodstream into cells. That sugar starts to build up in the blood, and eventually it damages the organs and systems that keep you healthy. Without proper management, diabetes can lead to nerve damage, kidney failure, foot ulcers, vision loss, and a significantly increased risk of heart disease and stroke. And in older adults, these complications progress more quickly and are often harder to recover from. But here's the key. It's highly manageable when caught early, and sometimes even preventable. For many seniors, a simple blood test at an annual physical can reveal pre-diabetes, an early warning stage when blood sugar is elevated but not yet in the danger zone. At this stage, small lifestyle adjustments can often delay or even prevent full-blown diabetes. Diet plays a central role in managing blood sugar. That doesn't mean cutting out everything you love. It means focusing on whole, unprocessed foods that help stabilize your glucose levels. Think fiber-rich vegetables, whole grains, lean proteins, and healthy fats. Reducing sugar and refined carbohydrates is important, but so is timing meals consistently throughout the day. Regular physical activity helps too. Even a short daily walk can make your body more responsive to insulin and lower blood sugar naturally. For those already diagnosed, monitoring blood sugar levels, taking medications as prescribed, and working with a healthcare provider to manage diet and symptoms can make a dramatic difference in quality of life. The important thing is not to ignore the signs. Type 2 diabetes doesn't always make a loud entrance. Sometimes it whispers. But the sooner you listen, the better your chances of staying healthy, independent, and in control. Getting older doesn't mean giving in to chronic illness. It means being smarter, more proactive, and more connected to what your body needs. And when it comes to diabetes, knowledge truly is the best form of prevention. At number 1, we arrive at one of the most dangerous yet often underestimated health threats for older adults: respiratory illnesses, particularly COPD and pneumonia. These conditions carry a high mortality risk in seniors, and what makes them especially concerning is how quickly they can escalate from manageable to life-threatening. For many, it starts as a persistent cough or shortness of breath. But in older bodies, especially those with weakened immune systems, these symptoms can progress into something far more serious. COPD, or chronic obstructive pulmonary disease, is an umbrella term for long-term lung diseases like emphysema and chronic bronchitis. It's usually caused by a history of smoking, but long-term exposure to air pollution, chemical irritants, or secondhand smoke can also play a role. Over time, the lungs become inflamed and damaged, making it harder to breathe, especially during physical activity. Pneumonia, on the other hand, can come on suddenly. It's an infection that causes the lungs to fill with fluid, leading to fever, cough, chest pain, and labored breathing. For seniors, especially those with existing heart or lung conditions, pneumonia can become deadly in a matter of days. What makes respiratory illness particularly dangerous is that it often hides in plain sight. A lingering cough, feeling winded after climbing stairs, needing longer to catch your breath after mild activity. These signs are often dismissed as just aging, but they could be signals that the lungs aren't working as they should. Prevention is key, and it starts with something simple: vaccines. The annual flu shot and the pneumococcal vaccine are essential tools for protecting vulnerable lungs. These vaccines don't just reduce your risk of illness, they can also significantly lower your chances of hospitalization or death if you do get sick. Avoiding known triggers is also crucial. That means steering clear of cigarette smoke, dust, mold, and strong chemical fumes whenever possible. If you use oxygen or inhalers, follow your care plan carefully and keep your equipment clean and up to date. And don't underestimate the power of movement. Regular, gentle exercise, like walking, swimming, or even chair yoga, can help keep the lungs strong, increase oxygen flow, and reduce the likelihood of complications. Respiratory illness can feel isolating. Struggling to breathe often leads people to avoid activity, social events, or even daily tasks. But with proactive care, education, and a little support, it doesn't have to mean giving up your freedom. Whether it's COPD, pneumonia, or simply struggling to breathe more than you used to, don't ignore the signs. Talk to your doctor, get the vaccines, strengthen your lungs with daily movement, because breathing isn't just essential, it's your connection to life, and it deserves to be protected. After hearing about these 5 major illnesses, it's easy to feel overwhelmed, but the truth is, you have more power than you think. And that power starts with what you do today. One of the most important steps any older adult can take is to stay consistent with routine checkups. Whether it's your primary care doctor, a specialist, or even your dentist and eye doctor, regular visits help catch things early before they become serious. Many illnesses that impact seniors, like diabetes, heart disease, and even certain cancers, begin with subtle symptoms that only show up in routine screenings. It also means tuning into your own body. That strange fatigue, the extra trip to the bathroom, the shortness of breath that wasn't there last year, these aren't just getting older, they're signals. Your body is always communicating. Learning to listen with curiosity, not fear, is one of the smartest health habits you can develop. Equally important are the small, daily habits that lay the foundation for long-term health. Movement doesn't have to mean a gym membership. A gentle walk, a stretch in the morning, or dancing to your favorite song in the kitchen can all improve circulation, mood, and mobility. Even 5 minutes a day is a step in the right direction. Hydration is often overlooked, but it plays a major role in everything from joint health to brain function. As we age, the sensation of thirst can dull, so make a conscious effort to sip water throughout the day. Don't forget social connection and stress management. Loneliness and chronic stress are silent threats that weaken both physical and mental health. Call a friend. Join a local class. Practice deep breathing or write in a journal before bed. These may seem small, but they create resilience. And if you're not sure where to begin, look into community health screenings and early intervention programs. Many local clinics, pharmacies, and senior centers offer free or low-cost screenings for blood pressure, glucose, cholesterol, memory, and more. These services exist for a reason, because catching something early often changes the entire outcome. The goal isn't perfection, it's awareness. It's about building a relationship with your health that's based on partnership, not fear. Aging isn't something to fight against, it's something to navigate wisely. And every step you take to care for your body, mind, and relationships today makes tomorrow a little more secure. Because your health journey doesn't end with age, it evolves. And with the right choices, support, and information, you can face each new chapter with strength, clarity, and confidence. By now, you've heard the 5 illnesses most commonly affecting older adults today. And hopefully you've also seen something just as important. Aging doesn't have to mean suffering. Yes, the body changes, the risks increase, and the challenges are real, but with awareness comes power. Power to recognize warning signs early, power to speak up at appointments, power to take small daily steps that add up to major shifts in health, mobility, and peace of mind. You can't change the clock. You can't turn back time or undo every ache and diagnosis. But you can absolutely change how you care for yourself moving forward. And that shift, no matter how small, can change everything. Start with curiosity. Notice how you feel when you eat certain foods, how your energy changes after a walk, how your mood shifts after talking with someone who makes you laugh. Health isn't just numbers on a chart. It's how you feel in your body and your life. You deserve to feel good in both. And if someone you love is facing one of these illnesses, whether it's heart disease, diabetes, arthritis, memory loss, or respiratory trouble, remind them they're not alone. Aging is something we all walk through eventually, but no one should have to walk through it unsupported or in silence. Offer them encouragement, even if it's just a simple, "I see you, you're doing your best, and I'm here." Sometimes that kind of compassion is more powerful than any prescription. The truth is, many of these conditions aren't about doing something wrong. They're about life, genetics, and time. What matters most now is not judgment, it's understanding. It's learning what your body needs today and responding with care. Because health at this stage of life isn't just about living longer, it's about living better, with clarity, connection, and comfort, with choices that reflect not just survival, but dignity. This isn't just a video about illness. It's a conversation about hope, about truth, and about what's still possible when we choose to pay attention. So be kind to your body, speak gently to your heart, stay informed, stay involved, and stay open to the idea that there is always something you can do starting today, because you haven't missed your chance. There's still time to move more, to eat better, to ask the right questions, and to love yourself enough to take your health seriously. You're not too late. You're right on time. If this video helped you see things more clearly or reminded you of someone who could use support, please share it. You never know whose life it might change. Subscribe to Elderly Truths for more honest, compassionate conversations about growing older with strength, wisdom, and dignity. And if you're facing one of these illnesses or loving someone who is, know this: you're not alone and you're not forgotten. Your story matters. Your health matters. And it's never too late to take the next step toward a better tomorrow. Until next time, be kind to yourself and take care of those who took care of you.